Yes, this particular approach is inferior, but you can also do it on the superior portion of the joint. But one I presented is just above the sciatic notch, right down through the synovial portion of the joint. And if you look at the diameter compared to the extra articular recess, the distance between the subchondral bone of the sacrum and ilium is about 5 millimeters, and it's up against dense bone. So it's not like we need a large bridging distance for the bone, so it typically heals fairly quickly.
Yeah, I have seen in the United States a lot of company approaching to the non-surgeon physician that they're treating sacroiliac joint, and basically they're promoting this piece of dead bone, like an allograft bone, to put it inside the joint. And I don't know what's going to be the long-term outcome of those cases.
No, that's a good question, and you know, there's no doubt that the interventional pain physician group is expanding their domain in spine surgery in many ways. As you know, there's the mild procedure, there's all sorts of Minuteman and you know, SI fusion. So that's going to evolve with time. But I think, again, you know, not understanding that, you know, unless you have everything performed properly and you have rigid fixation and you try to just impact an allograft, you get micro fractures and it resorbs. I think we're going to see that just become less and less effective, like we have seen in other areas of orthopedics.
Thank you.
I'd just like to make a comment. We specifically put it in our indications and contraindications that our procedure should not be done outside of an environment where there's a full understanding of the surgical anatomy, an ability to manage the complications. And so we don't think that it's going to apply. I hope that the pain doctors don't pick this up and try to do it, because I think, like any procedure, there's a lot more to it than maybe it first meets the eye.
Well, they got their own belief system and training programs, and a lot of you know, industry is, you know, backing up their ideas. So we'll see where it goes.
We'll see where it goes. Volker's smiling. Are you happy, Volker?
See where it goes. Yes, that's a good question. Yeah. Okay, to see where it goes. Maybe we should move on to the next talk.